A little boy holds her tight, a little girl cries out loud. The fever, it hurts inside, it feels like there's no way out of this nightmare. The symptoms that speak are clear. I sit and I wonder why another one has to die. We're losing our people every day, and every day malaria thrives, taking our children and dreams away. And we stand prepared
to defend Africa,
and we take a stand
to fight malaria.
So please lend a hand.
Save our future, take the
Do you know the leading cause of morbidity and mortality in Kenya? If you don't, then follow us to unravel the hidden truth around the country.
Now, malaria is one of the leading causes of morbidity and mortality in the country, contributing to 30% of outpatients, about 15% inpatient.
It is estimated that 21,000 children die every year in Kenya before celebrating their 5th birthday. This means that Kenya loses 57 children every day from malaria alone.
Take a stand.
to fight malaria.
So please lend a hand.
Save our future, take the lead. We can do it, we're a team, together with more team.
There is a voice that cries.
Malaria is the leading cause of morbidity and mortality in Kenya, with close to 70% or 24 million people at risk of infection. Although malaria affects people of all age groups, children under 5 years of age and pregnant women living in malaria endemic regions are the most vulnerable. The human toll malaria exacts and the economic and social impacts are devastating. Sick children miss school, working days are lost, and tourism suffers. Malaria becomes a self-perpetuating problem, where the disease prevents the human and economic capital necessary to bring the disease under control.
The complexity of the disease is that it can exist in 3 areas: in the vector itself, which is the mosquito, in the human body, which is also very complex, and then you have the parasite itself, and this parasite can keep changing.
Moreover, malaria disproportionately affects the rural poor, who can neither afford insecticidal bed nets for prevention nor access appropriate treatment when they fall sick. Malaria prevention and control activities in Kenya are guided by the National Malaria Strategy Vector Control.
In terms of the activities that we have undertaken with the indoor residue spraying, we are happy to note that to date, about 6 million people are being protected through the indoor residue spraying initiatives that we have supported the government of Kenya. In Kenya, as Dr. John Logedi said, some of the interventions that we support are the procurement and distribution of long-lasting insecticide-treated nets. Since we started PMI in Kenya in 2008, we have procured and distributed over 20 million treatment doses of ACTs in support of the government policy and in line with the treatment guidelines of this country.
Malaria prevention and control activities in Kenya are guided by the National Malaria Strategy Vector Control, case management using artemisinin-based combination therapies, management of malaria in pregnancy, epidemic preparedness and response, cross-cutting strategies including information, education and communication for behavior change, as well as effective monitoring and evaluation.
The past year, we began the distribution of 11 million long-lasting insecticide-treated nets, bed nets, in Western, Nyanza, Coast, and parts of Rift Valley at a cost of Kenya shillings 5.6 billion. We have so far distributed over 8 million nets and plan to conclude the exercise by conducting mass distribution of the existing remaining bed nets in the counties of Coast Province, some parts of Rift Valley Province in the next 2 months.
Very colorful.
This National Malaria Strategic Plan 2009 to 2017 elaborates the efforts required to scale up malaria control and provides the platform needed to realize the vision of a malaria-free Kenya.
That Kenya is far ahead in terms of its malaria control program. Far ahead in terms of understanding what the malaria picture in the country looks like. Far ahead in terms of deciding on what the country needs to do to deal with the malaria burden. As others who have spoken earlier before me quoted from the speech of the WHO Director General, you need to know your enemy in order to defeat that enemy.
The strategic plan is in line with the ministry's vision to transform Kenya into a nation free from preventable diseases and ill health.
While we celebrate these gains that have been achieved over the years, these, while it's encouraging gains, are very fragile. And it's vital, therefore, that we all together pull in the same direction to protect and jealously guard them. I would like to appreciate the fact that today we can talk about we've come from far. Looking at 80% disease prevalence to 38% in some of the parts, reduction is not easy.
And the overall plans for realizing the targets set out in Vision 2030 for the health sector, as well as the global malaria targets on universal coverage and access.
In the area of access to effective malaria treatment, the ministry launched the Affordable Medicines for Malaria program in October 2010. The objective of the program was to reduce the cost of quality assured malaria medicines, ACTs, from a high of Kenya shilling 600 per treatment to between 10 and 40 shillings through a subsidy mechanism supported through the Global Fund.
Malaria control is not just a health issue. It is an overall development issue, as malaria is a driver of poverty. This year, prior to the actual commemoration on 25th April 2012, a media breakfast briefing meeting was held on 19th April at the Sarova Stanley Hotel, supported by the Clinton Health Access Initiative. The national event took place at Mrima Primary School, Msambweni District, Kwale County in Coast Province, with funds realized through partners and stakeholders to facilitate the commemoration.
Tushikane sote na tujadiliane kuhusu jinsi ya kuzuia ugonjwa wa malaria. Tumesikia mashauri yote yanatufundisha moja ama mawili ambayo tunatakiwa kuchukua ili kujilinda na kujikinga kutokana na ugonjwa wa malaria.
An estimated 3,000 people attended the occasion. Amongst the goals for Malaria Day is to reflect on the gains and achievements of the past 11 years, built on a national multi-sector movement for a malaria-free Kenya.
Mama mjamzito aweze kwenda kliniki angalau mara 4 wakati wa hiyo miezi 9 Ukienda hapo unaweza kupimwa damu, unaweza utapewa neti, utapewa dawa ya malaria, na uambiwe mambo mengi kuhusu chakula ili uwe na afya na mtoto awe na afya.
One of the objectives is to advertise Kenya's success in achieving progress and impact in winning the war against malaria. A second objective is to secure high-level political and partner commitments to a vision of a malaria-free Kenya.
Manyasi huwa dhahabu, mbu furahi sana, na hilo ndio sababu malaria inatubana. Tupigeni mbu vita, tuangamize malaria.
You need to know that you have malaria before you are given malaria medicine. When you do that, you will be helping this country sustain the gains of malaria. The theme of the 2012 World Malaria Day is sustain gains, save lives, invest in malaria. The theme draws attention to the progress made and urgent need for adequate investment to defeat malaria. In Kenya, there is evidence that consistent investment in malaria control in the last 10 years is having the desired impact. In the coastal region, less than 5 out of 100 people with fever are truly malaria.
This year's theme and slogan for World Malaria Day was Sustain Gains, Save Lives, Invest in Malaria, and Pamoja Tuendelee Kuangamiza Malaria.
Every day, malaria thrives, taking our children and dreams away. Now we stand prepared, and we take a stand. So please lend a hand.
Save our future, take the lead. We can do it, we're a team.
Together we're one team. So I'm telling every mother, I'm telling every child, no stagnant waters, so mosquitoes cannot hide. Be sure to stay protected, do all that you can. Come on, let's fight malaria. Defend Africa. To fight malaria. Save our future, take the lead. We can do it, we're a team. Together it takes you, it takes me to defend Africa. Takes everyone of us to make this a reality. To fight malaria. Save our future, take the lead. We can do it, we're a team. Together we're one Tuangamize malaria. Tuangamize malaria.
Malaria prevention and control activities in Kenya are guided by the National Malaria Strategy Vector Control, case management using artemisinin-based combination therapies, the management of malaria in pregnancy, epidemic preparedness and response, cross-cutting strategies including information, education and communication for behavior change, as well as effective monitoring and evaluation. Okay?